Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, I've got a special guest for you today. It's me. I'm going to be talking with you today about practical steps that you should take whenever a doctor prescribes medication for you. Now, you may ask yourself a really important question, which is, why am I talking about this? So, I am a medical intuitive healer. I have clients in 6 continents. I have 31 years experience. And people reach out to me to solve actual problems. So I'm going to start by telling you a story. So earlier this week, a wonderful woman reached out to me because she was having symptoms of a urinary tract infection. She went to her doctor and they tested her for a urinary tract infection, but they couldn't find any signs, medical signs of urinary tract infection. They did a urinalysis with her. The urinalysis showed up, everything was fine. And yet she was still having horrific pain that was quite debilitating for her. And that's why she reached out to me. So she reached out to me, and the presenting symptoms were severe urinary pain. And bottom line, what I figured out was she was taking too many medications. Now, I want to start by saying, giving you a little bit of background about myself, a little bit of family background. My brother's a doctor, my father's a doctor, my grandfather was a doctor, my great grandfather was a doctor, my uncle was a doctor. There are great doctors and terrible doctors. There are wonderful holistic people like myself I've spent my whole career helping people be healthier and happier. And there are other people who are just out to take your money and use you and really don't know what they're doing. So there's good people and bad people on all sides of the spectrum when it's coming to the issue of your personal health. And I like to joke, I'm not a doctor. I don't play one on TV. I am, however, a medical intuitive healer, and I'm like a little detective working with people to try and figure out, why is it that you're not well? So I worked with this wonderful lady on Zoom, and it literally took us 45 minutes to go over all of her medications, all of her prescription medications. And just taking a very common sense approach, what I found was that number one, 3 of the medications that she was taking that had been prescribed by her doctor were adversely affecting kidneys and had potential negative effects on the kidneys. And this was all according to medical literature widely available on the internet. And number two, 2 of the drugs she was taking had a negative interaction with each other. Now, if you go to a doctor and they prescribe medication for you, you may assume, I have an intelligent doctor, he went to medical school, he cares about me, and all of those facts may be absolutely true. My brother is a wonderful doctor. I love him. He's an eye surgeon. I've been to him as a patient. He's checked my old eyes. I'm 66 now. And he's a fantastic practitioner. However, he sees about 65 patients a day. And a slow day, he'll see 50 patients. And so when you go to a doctor, you have to assume that your medical doctor is going to be seeing many, many people every single day. And they may not be checking, what are the side effects of your medications? Do you happen to have any side effects that go along with this? And most importantly, are you taking more than one prescription medication that may not interact or play well with any of the drugs he or she is recommending? So bottom line, when I worked with this lovely lady who was in severe pain, and I pointed out that three of her drugs were were known to cause kidney problems. The doctor that she had gone to explaining that she had severe urinary pain had not looked up this information. And this wonderful lady had a history working in the medical field. And number two, they had also not discovered the basic fact that two of the drugs that she was taking are known to have adverse consequences when you take them together. So those of us who are in natural healing, when we go to the doctor and we're prescribed a medication, there's some common sense steps that I advise you to take. So number one, every time you are prescribed any medication, you want to do your own work and look up the side effects of every single drug you're prescribed. And there's a wonderful website called rxlist.com. You can look up any medication at rxlist.com. But number two, and this is so important, you need to check for drug interactions. And the average American adult takes 4 prescription medications every year. And around 61% of US adults report taking at least one prescription drug every year. So, frankly, it's easier if you're only taking one drug because then you only have to look up the side effects of one drug. But whenever you're taking more than one drug, whether that drug be legal or illegal, it's really critical for you that you research for yourself how those drugs interact. And of course, the older you get, the more likely you are to take more than one drug. Number three, and this is also important, you want to check to see if your medication causes nutrient deficiencies. And I hope I have time in this broadcast to talk about some of those. So if you take a medication, then one of the things you can do, in addition to looking up side effects, you can look up and see whether the drug that you're taking is causing specific causes and known to cause nutrient deficiencies. And this is pretty well researched. You can look up any drug you're taking and see if it's causing nutrient deficiencies. And then once you see the side effects of all these drugs, and I'm going to be talking about some of this in this broadcast, perhaps that could motivate you to research if there are natural ways that you can, and natural steps that you can take to heal your health naturally. And that's what I'm talking about here at the Natural Healing Show for UK Health Radio. We talk about how to solve all kinds of health challenges naturally without drugs. Now, to help you understand how important this is and the severity of what I'm talking about, I decided in this broadcast, I'm going to be talking about the 10 most commonly prescribed prescription drugs in the United States. So I'm going to be going through each medication, and then I'm going to be talking about the side effects, the common side effects, the severe side effects, and then a little bit about what is known about how each drug interacts with other medications. So as I share this information with you, please know I'm not trying to scare you. I'm just trying to present common sense information, because just like my client who was lying in bed writhing in pain, when she realized the medical literature that 3 of her drugs were hurting her kidneys, she could reach out to her doctor and talk about how she could do things differently. And it certainly helped her realize the combined effect of everything that she was taking. So let's go through some of these 10 most commonly prescribed drugs in the United States. And by the way, I'm not a pharmacist, and more than likely I may mispronounce some of these drugs, so hang in there with me. So the first one that I may be talking about is a drug for blood pressure, lisinopril, also known as, it's the generic drug name for Zestful. So mild side effects of lisinopril include headache, dizziness, GI upset, and chest pain. Now, severe side effects of lisinopril include hypotension, low blood pressure, and that could cause you to feel dizzy or lightheaded, feeling dehydrated, trouble concentrating, or fainting. And then here's the next big one. So just like my client writhing in bed with urinary tract pain, but the doctors could not find any trace of a UTI. So lisinopril can cause kidney problems, including acute or sudden kidney failure. Symptoms can include swelling in your ankles or legs, confusion, shortness of breath, nausea, and tiredness. Lisinopril can also cause liver damage, and symptoms can include jaundice or yellowing of your skin or the whites of your eyes, dark urine, elevations in liver enzymes on lab tests, pain in your upper right abdomen, unexplained weight loss, and severe sudden swelling that forms under your skin, also known as angioedema. So symptoms can include swelling that affects your arms, face, intestines, legs, lips, tongue, voice box, or vocal cords, trouble breathing, abdominal pain, and allergic reaction. Lisinopril can also cause changes in your potassium levels, and if you're pregnant, it can harm a fetus or cause you to lose your pregnancy if you're taken while pregnant. Now, and again, when you read all this, you want to ask yourself, if I do have high blood pressure, what are some of the things that I could do naturally? Maybe I can do breathing exercises. Maybe I can lower my stress. Maybe I can change my diet. So some of the medications that do not play well with lisinopril include diuretics. Taking a diuretic with lisinopril could lead to a severe decrease in your blood pressure. Non-steroidal anti-inflammatory drugs, such as ibuprofen, like Advil or Motrin, and taking a non-steroidal anti-inflammatory drug with lisinopril can raise your risk of kidney damage. And again, forgive me if I stumble over the names of some of these words. Angiotensin receptor blockers, such as valsartan or Diovan. Taking these drugs with lisinopril could raise your risk of side effects, including low blood pressure, high potassium levels, and kidney damage. Lithium. Taking lisinopril with lithium can increase the levels of lithium in your body, which can lead to a lithium overdose. Symptoms of lithium overdose may include tremors, mild twitching, or spasms, or uncontrolled rapid eye movement. And again, I'm going to be stumbling over some of these words, rapamune and Afinitor Zortress. Taking these drugs with lisinopril may raise your risk of angioedema. And injectable gold. Taking lisinopril with injectable gold could cause a reaction similar to nitrite poisoning. Symptoms include low blood pressure, flushing, and nausea or vomiting. Okay, so we just talked about a very common medication that many people all over the world take for blood pressure, high blood pressure. So again, if you're taking these things, it's really a mistake to think that your doctor is going to fully explain to you what you may experience. And when you really see all these side effects, this may actually motivate you to take better care of your health. Now, the second drug that I want to talk about is Synthroid. So many people take Synthroid, also known as levothyroxine, for low thyroid. Some of the more common side effects of levothyroxine or Synthroid include increased appetite, weight loss, heat sensitivity, excessive sweating, headache. And when you read the side effects of these drugs, headache is a very common side effect of many prescription drugs. So again, if you look at that, people take a drug, they get a headache, and then they take another drug to deal with the headaches. So you're compounding your problems if that's the issue. Hyperactivity, nervousness, anxiety. So again, you're taking Synthroid for your thyroid, and then you feel anxious, and then you go to a psychologist or a psychiatrist. Maybe you're prescribed prescription anti-anxiety medication, rather than really looking at, is this a side effect of my drug? Irritability, mood swings. Again, Synthroid can send you to a psychologist. Trouble sleeping, insomnia, tiredness, tremors, muscle weakness, changes in your menstrual periods, hair loss, diarrhea, vomiting, and stomach cramps. Now, those are the less serious side effects. Serious side effects of Synthroid include heart attack, chest pain, shortness of breath, discomfort in your upper body, heart failure, shortness of breath, extreme tiredness, swelling in your legs, ankles, or feet, unexpected weight gain, very fast heart rate, irregular heart rhythm. And there's a number of drugs that are known, according to the medical literature, to have adverse effects when combined with Synthroid. Some of the common antidepressants, amitriptyline, and again, I'm going to butcher this one, I'm sure, maproteline. So antidepressant drugs with Synthroid, and I've seen many clients who are taking antidepressants and Synthroid together. The side effects of both the antidepressants and the levothyroxine may increase when you take the drugs together. And taking antidepressants with Synthroid may put you at higher risk for irregular heart rhythms or arrhythmias. Pseudoepinephrine and albuterol. The effects of these drugs may increase if you take the drugs together, and they may put you at risk for serious heart problems. So when you take Synthroid with blood thinners such as warfarin, these drugs may increase your risk of bleeding. You may need to decrease the dosage of your blood thinner if you're taking Synthroid. And ketamine. Many people have heard about ketamine and they're taking ketamine to improve their mental health. But if you take ketamine with Synthroid, you may increase your risk of high blood pressure and fast heart rate. So, and I could go on. And then there's other drugs that if you take them with the Synthroid will cause your Synthroid to be less effective. So for example, if you take the antidepressant sertraline with levothyroxine, you may need, your doctor may want to increase your Synthroid dosage to keeping it work it well for you. Anti-seizure drugs will make your Synthroid less affected. Calcium carbonate or ferrous sulfate are going to interact poorly with this. And then there's a bunch of drugs whose names I'm looking at the name and I'm not sure I can even pronounce it. But bottom line, you need to know that if you take other drugs with Synthroid, then the other drugs and the Synthroid together may increase your risk of side effects and then also cause your Synthroid not to work as well. Cancer drugs that belong to the tyrosine kinase inhibitors class may also cause this, and antacids may cause problems with your Synthroid. And with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. I'm talking to you about common sense steps you can take if your doctor recommends a medication for you. Because as a medical intuitive healer, I frequently see people and what their complaints are, what they're calling me about is a side effect of one of their medications. We'll be right back. Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. I'm talking to you today about common sense steps you can take if your doctor prescribes prescription medications. So I started this broadcast by telling the story about a woman who reached out to me with severe urinary pain, and her doctors could not find any symptoms of a UTI. Her urinalysis proved okay, but she was still lying in bed with severe pain in her urinary tract. So again, you can't assume that just because you go to the doctor and you tell them all the medication that you're taking, that they're going to actually do the work of looking up the side effects, number one, or number two, they're going to look at how all the drugs you are taking play well or not with each other. So it's incumbent upon us to actually do this work so that you become an informed consumer. So for example, if you were prescribed a new medication, you really want to know the side effects. And often when I have a new client and they're on one or more prescription medications, a common piece of homework that I give my new clients is I say, look up the side effects and then circle every side effect that you have. Because a lot of times you think, oh, maybe my health is declining and maybe it's actually from your medication. And when we understand how severe some of these side effects can be, perhaps that could motivate you to take better control over your health and to turn to natural healing. Now, the next drug I want to talk about is Lipitor, also known, and again, I'm going to probably butcher this, as atorvastatin. It's a statin drug prescribed for high cholesterol. And here at the Natural Healing Show for UK Health Radio, I did a really good interview with Dr. John Abramson, who is an author, and he has done he's a Harvard-trained MD and author, and he's done some research about statin drugs. And basically, the bottom line is that statin drugs are very good for the drug companies because you prescribe them usually for life, but may not be good for you. So some of the more common side effects of Lipitor include cold symptoms such as runny nose, sneezing, and coughing. And again, if you think about cold symptoms, when you get a runny nose, sneezing, and coughing, often then you turn to over-the-counter medications to deal with your runny nose, deal with your cough, or maybe even herbs, but you're not really connecting to the fact it may be your Lipitor. Diarrhea, gas, heartburn, joint pain, forgetfulness. So you start taking Lipitor, and then you think, I'm losing my mind, maybe I'm getting dementia, and it's really a side effect of your drug. Confusion, and here it is, again, urinary tract infection. Now, those are just some of the mild side effects of Lipitor. Some of the serious effects of Lipitor include muscle problems, including unexplained muscle weakness, tenderness, or pain, tiredness, liver problems, which may include tiredness or weakness, loss of appetite, upper stomach pain, dark urine, yellowing of your skin or the whites of your eyes, and allergic reactions. And there's a long list of drugs that Lipitor does not play well with. Certain antibiotics, for example, may increase when you combine the antibiotics with your Lipitor, may increase your risk for muscle problems. And examples of these drugs, erythromycin and clarithromycin, again, probably bungling that pronunciation. And when you combine fungal drugs with the Lipitor, that can cause the Lipitor to build up in your body and raise your risk for muscle breakdown. So examples of these drugs, and I'm probably going to bungle the pronunciation, ketoconazole and itraconazole. Cholesterol-lowering drugs, and many people who go to their cardiologist are taking statin drugs along with other cholesterol-lowering drugs, and if you take these together, that may raise your risk for muscle problems. So examples of these drugs include gemfibrozole and medications that include fibrate, and also the supplement niacin, a B vitamin. Now, if you take rifampin with Lipitor, it may lower the amount of Lipitor in your body, and that may cause the Lipitor not to work as well. HIV drugs may be a problem, and oral birth control pills may be a problem, and I could go on. Now, the next drug I want to talk about is one that's commonly prescribed for type 2 diabetes. Metformin, also known as glucophage. And again, in this show, for the Natural Healing Show for UK Health Radio, I've done a number of shows about how you can balance your blood sugar naturally. So we talked about how to heal your metabolism naturally. And there's a bunch of wonderful things that you can do if you do have blood pressure problems. But if you're taking metformin, side effects can include a runny nose, low blood sugar, excessive sweating, chest discomfort, headache. And again, if you think about some of these common symptoms, you're taking metformin, you get a headache, you take another drug to deal with that, and also weakness. Now, in rare cases, metformin can cause lactic acidosis, a serious side effect, and that can lead to low blood pressure, a rapid heart rate, and even death. Vomiting and dehydration increase the risk of lactic acidosis in people taking metformin. And metformin may also affect your absorption of B12. So people who are taking metformin may be advised for their doctors to monitor their B12 levels. And it may also lower the levels of calcium and the absorption of calcium, thereby affecting your bones. Now, there's a long list of drugs that do not play well with metformin, including diuretics, corticosteroids, thyroid medicine, estrogen, insulin, alcohol. So if you're taking metformin and you're drinking alcohol, that may be a serious problem. Cimetidine, ranolazine, carbonic anhydrase inhibitors. So again, if you're taking metformin, you really want to do the research and find out, how does this drug play with others? And with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. I'll be right back. Catherine Carrigan, medical intuitive healer here, talking to you about common sense steps that you can take if your doctor prescribes prescription medications for you. Now, big picture, why am I talking to you about this? People from all over the world reach out to me because they're experiencing symptoms that they do not understand, and often that their doctors don't understand either. So the average person who comes to see me has seen at least 7 other practitioners, both traditional medical and alternative. And again, I'm not a doctor. I don't play one on TV, but frequently I find that the reason I'm doing this broadcast is that so many of my clients, what they're experiencing is actually a side effect of their medication. And if you are listening to this broadcast and you're connecting the dots with your own health, and you realize, okay, maybe that headache, maybe that urinary problem that I'm having, maybe that fatigue, maybe my problems losing weight, or maybe my problems in being unable to gain weight, maybe that has something to do with the medications that I'm taking. So if you're listening to me, again, you want to, number one, look up the side effects of every medication you're taking. Number two, actually research how all the drugs that you're taking are interacting. And then number three, what I have my clients do is when you find out this information, write down all the symptoms that you're experiencing. And one of the basic premises in natural health is something called biochemical individuality. So something may work for 100 people and you're the 101st person and it doesn't work for you. And just that, as that is true with natural remedies, it's also true with medications. And it's really important that if you're experiencing side effects from your medications, that you take the time to call your doctor's office, talk to a nurse, talk to the doctor in person if you can, and describe to them what you're actually experiencing. So, and then finally, hopefully this will motivate you to look into natural ways of taking care of your health. So the next drug I want to talk to you about is another statin drug known as Zocor. This is another drug that's commonly prescribed for high cholesterol. And again, you can listen to a radio show that I did with Dr. John Abramson about statin drugs and how they may not actually benefit your health. Mild side effects of Zocor include abdominal pain, constipation, eczema, nausea, gastritis, inflammation of the stomach lining, high blood sugar, again, headache, muscle pain or weakness, upper respiratory infections, such as bronchitis and sinusitis, and again, urinary tract infection. Now, if you've been listening to me, and these are the most common drugs in the United States, you'll see some of the common side effects of these drugs: headaches, urinary problems, fatigue, muscle weakness. And this is your drugs that you think are trying to help you. Now, serious side effects of Zocor may include liver problems, such as elevated liver enzymes, fatigue, nausea or vomiting, swelling in your abdomen, ankles, or legs, urine that is darker than usual, jaundice, muscle breakdown. And when that happens, you lose consciousness, you're nauseous, your urine is brown, red, or tea-colored, severe muscle pain and weakness, and allergic reaction. Now, there's a very long list of drugs that interact adversely with Zocor. Some of the most common ones that I want to point out are antibiotics, antivirals, antifungals, warfarin. So again, calcium channel blockers. So you really, if you're taking Zocor, you really want to do the research and find out if you're taking any other drug that does not play well with that. Next drug I want to talk about is omeprazole, which is prescribed for high stomach acid. Common side effects of omeprazole include headache, stomach pain. So you're taking this drug for high stomach acid and it actually causes stomach pain, nausea, diarrhea, vomiting, and gas. Serious side effects may include low magnesium levels, seizures, irregular or fast heart rate, tremors, jitteriness, muscle weakness, dizziness, spasms of your hands and feet, cramps or muscle aches, spasm of your voice box, and B12 deficiency. Symptoms of B12 deficiency include nervousness, neuritis, inflammation of a nerve, numbness or tingling in your hands and feet, poor muscle coordination, changes in menstruation, severe diarrhea, inflammation of your stomach lining, bone fractures. And again, if you're listening, you'll find that many of these drugs are going to affect your bones. And so many of people, as they age, are subject to osteopenia and osteoporosis. Kidney damage, again, here we go again, kidney damage. And symptoms of this can be pain in your side or back, changes in your nation, and cutaneous lupus erythematosus, CLE, rashes, and systemic lupus erythematosus, SLE, and the symptoms may include fever, tiredness, weight loss, blood clots, and heartburns, and as well as polyps. And again, there's a long list of drugs that you should not be taking if you take omeprazole. And again, I'm going to let you look those up, but some of the ones that you should not be taking include warfarin. And again, I'm going to just pass on pronouncing all of these. And then there's some drugs that if you take the omeprazole with them, the drug interaction, they may make your omeprazole less effective. So a long list, including St. John's wort, which is a commonly taken herb in natural healing for depression. So again, if you're listening to me and you're making the connection that maybe some of the symptoms you've been feeling may possibly be a side effect of your medication, do the research, talk to your doctor, call your nurses, and find out what you can do naturally instead. Another drug that's commonly prescribed for high blood pressure is amlodipine. And again, forgive my pronunciation. So common side effects of amlodipine include swelling of the legs and or ankles, fatigue, sleepiness, abdominal pain, nausea, dizziness, flushing, and heart problems. Serious side effects of amlodipine include low blood pressure, severe dizziness, lightheadedness, fainting, more chest pain or a heart attack, chest pain or discomfort, upper body discomfort, shortness of breath, breaking out in a cold sweat, unusual tiredness, nausea, and lightheadedness. And so I also want to say, as I research the side effects of medications, one of the common thoughts that I have is that if there were any natural supplement that caused half of these side effects, they would probably be banned in the United States. So the next drug I want to talk about is metoprolol, also known as Lopressor and Toprol XL, and it's another drug for high blood pressure. Now, this drug, metoprolol, includes an FDA black box warning. And a black box warning, what is a black box warning? It's the most serious warning from the FDA. It is a black box warning, alerts doctors and patients about drug effects that may be dangerous. So if you're taking metoprolol and you realize you're having some of the side effects, you can't just stop taking it suddenly. If you do, you may experience worse chest pain, a jump in your blood pressure, or even have a heart attack. Stopping metoprolol is not recommended. If you need to stop taking the drug, first talk to your doctor. Your dosage should be gradually decreased under a doctor's supervision. Now, whenever I have clients who have side effects of their drugs, again, the first step I'm going to do is send them back to the doctor because legally I'm not allowed to comment on medication. But most of this information is commonly available in the medical literature. Common side effects that can occur with metoprolol include tiredness, dizziness, diarrhea, constipation, breathing problems such as shortness of breath, cough, and wheezing, bradycardia, which is heart rate that's slower than normal, reduced interest in sex, and a rash. Serious side effects and their symptoms can include low blood pressure, severe dizziness, lightheadedness, fainting, cold hands and feet that may be very painful, very slow heart rate, severe bradycardia, extreme fatigue, and also serious depression. So this is continuous feelings of sadness or anxiety, feelings of hopelessness or worthlessness, lack of interest in hobbies you once enjoyed, and eating too much or too little, trouble concentrating. And when you take metoprolol with mental health drugs, so again, if you really get that metoprolol can cause you to be depressed, then you go to your psychologist or psychiatrist and they prescribe mental health drugs, then the interaction between your mental health drugs and metoprolol can be even worse. So when you take metoprolol with monoamine oxidase inhibitors, MAOIs, they may increase or add to the effects of metoprolol, and this may slow your heart rate, increase your lightheadedness. I have a client whose husband is in his 90s, and he was having severe heart problems. He's been having severe heart problems ever since having COVID last year. And she and her husband are in a bit of a dilemma because the medication that would be recommended for the heart issue that he has would cause lightheadedness, dizziness, and potentially falling. So she said, our choice is, does he take the drug, feel lightheadedness, fall, and break his hip, and then he's in pain and unable to move? Or do we not take the drug and risk having him have a severe heart attack and then he's gone in a heartbeat? So as I present this information to you, I am mindful and compassionate that there's no easy answers for all of this. And that at the end of the day, we have to be responsible for our own choices. We have to become informed consumers. And also, we have to ask ourselves, what can I do to take better care of myself so that I don't end up having to take these drugs? Now, moving on, another common drug that many people take for pain is the combination of acetaminophen and hydrocodone. So acetaminophen and hydrocodone is another drug that comes along with a US FDA black box warning. So this is the Food and Drug Administration warning about a drug effects that may be most dangerous. So this may cause addiction, abuse, and misuse. So when you take acetaminophen and hydrocodone, you're increasing your risk for narcotic addiction, abuse, and misuse. This could lead to overdose and death. Due to the risk of side effects, the U.S. Food and Drug Administration requires a risk evaluation and mitigation strategy for this drug. So this drug may slow or stop breathing. If you take this and accidentally, especially by children, it could actually kill you. And it may cause terrible withdrawal symptoms, especially in newborn infants. You have to be very careful if you take this during any time during pregnancy, because it may lead to your baby having life-threatening problems after it's born. So there's a lot of negative side effects and negative with drug interactions with hydrocodone and acetaminophen because they are all broken down by your liver. So if you're taking other drugs with hydrocodone and acetaminophen, that could cause all the drugs to build up in your liver, increasing all the side effects and increasing breathing problems. Acetaminophen and hydrocodone may cause liver failure. You should not be drinking alcohol if you take this. And if you're taking acetaminophen and hydrocodone with any central nervous system depressant or opioids, such as benzodiazepine or alcohol, and you take all this together, it may result in excessive sedation, slow breathing, coma, and even death. So, as I conclude this broadcast, I advise you to be an informed consumer, to take the time to do your own research, to talk to your doctor, to talk to the nurses, and to research how all your drugs are interacting. A very simple step to do is simply go to Google, put in the name of your drug, ask for side effects, and then also ask Google about Dr. Google about drugs that you should not be taking with any medication that you're taking. Please be mindful of your health. You're listening to Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. I've been wanting to do this broadcast for a while, but listening to the dear lady who had severe urinary pain due to the drugs that she was taking really motivated me to share this information with you. Thanks so much for listening. Realize that natural healing absolutely works. I'm 66 years old, take zero medication, healthy and happy. You can do it. Thank you so much for listening. You can find out more about me at catherinecarrigan.com and unlimitedenergynow.com. And remember to take better care of your health and turn to natural healing as your first step whenever you have a health problem. Thanks so much. We'll see you next time.